Hello, this is Marilyn from the Gerald L. Ignis Indian Health Center. I am a community health worker here. I am going to talk about stroke awareness. A stroke happens when a blood clot blocks flow to the brain. This causes brain tissue to become damaged, or it can die also. Most often, a clot blocks a blood vessel and stops blood from reaching parts of the brain. A little bit less of it, a blood vessel in or near the brain can burst. During a stroke, nearly 2 million brain cells die each minute that the stroke remains untreated. Immediate access to medical treatment makes a difference between full recovery and permanent disability. A few of the facts about stroke. It's the 5th leading cause of death in the United States. Over half of those stroke deaths do occur in women. Twice as many women die of stroke than breast cancer. So what is a stroke? To understand a stroke, we have to understand the brain. The brain controls our movements, stores our memories, and is the source of our thoughts, emotions, and language. The brain also controls many functions of the body, like breathing and digestion. To work properly, your brain needs oxygen. Blood carries oxygen and nutrients to the brain. When blood flow is disrupted, brain cells start to die within minutes, and a stroke occurs. Strokes have different effects depending on where in the brain they happen and how much brain tissue is damaged. Strokes can cause problems with movement, muscle control, thinking, memory, and speech. Symptoms of that damage starts to show in different parts of the body that is controlled by those brain cells. A small stroke can lead to temporary weakness in an arm or leg. A larger stroke can cause permanent loss of speech, paralysis on one side of the body, or even death. Like I said before, the understanding of the stroke, if something happens to block the flow of blood, brain cells start to die within minutes because they can't get any oxygen. That's what causes a stroke. There are 2 different types of stroke. Ischemic stroke occurs when blood clots or other particles block the blood vessels to the brain. Fatty deposits called plaque can also cause blockage by building up in the blood vessels. The other one is a hemorrhagic stroke. I know I'm not saying it too good. I think it's, but that's when a blood vessel bursts in the brain. Blood builds up and damages surrounded brain tissue. You can also educate yourself by learning FAST. You spell FAST, and the F is for face drooping, the A is for arm weaknesses, the S is for speech difficulty, and the T is time to call 911. You can educate and support them. You could also check out this website that I was checking out. That's pretty helpful to educate myself on strokes. It is www.stroke.org. There's also one that I thought was pretty cool. It's memorialmedical.com. Spot a stroke, be fast. Signs of stroke in men and women. So there's sudden numbness or weakness in the face, arm, or leg, especially on one side of the body. Sudden confusion, trouble speaking or difficulty understanding speech. Sudden trouble seeing in one or both eyes. Sudden trouble walking, dizziness, loss of balance, or lack of coordination. Sudden severe headache with no known cause. If you know anyone with any of the symptoms, please call 911 right away. There also can be different in men and women. As you can see, the women have more symptoms. Men tend to have like the face droop and arm weakness, speech difficulty, vision problems, trouble walking or lack of coordination, severe headache with or without a cause. Women add to that with like 4 different other symptoms, which is general weakness. They can be confused or disoriented or have memory problems. They can feel fatigue and have nausea or vomiting. So preventing stroke in our daily life, we can continue to nourish ourselves, exercise, limit our tobacco or limit it altogether and not smoke, or talk to your doctor about different factors that are in your family. Any barriers you may have And if you've had risk or had any symptoms, some people get prescribed aspirin that they take daily. So communication is key to success. Like I said, we could talk to our health providers of how to prevent a stroke. We can learn different ways. We can educate ourselves. There's a couple facts that I wanted to share with you, like stroke is the 5th leading cause of death in the U.S. and a leading cause of severe disability. And new treatments are available that greatly reduce the damage caused by a stroke, but you need to arrive at the hospital within 60 minutes after symptoms start to prevent the disability. And knowing stroke symptoms, call 911 immediately, and getting to a hospital are all crucial to your care. And there's another one, the last one I wanted to share was 2 million brain cells die every minute during a stroke, increasing risk of permanent brain damage, disability, and or death. We here at Gerald L. Ignis Indian Health Center would like to thank you at this time for your time. We would also like to give you a high five for taking such good care of yourself and your family. We are here if needed, so please feel free to reach out and set up your necessary appointments with your health providers. We are truly happy you take such good care of yourself, and for those who may need to start new, we are here for you as well, and look forward to see a healthier, happier you.